Hi there, it's Hal Feldman bringing you a great interview. It is just before 6 o'clock on April the 2nd on Thursday. As you can see, I have Daniella Levine Cava with me. She's the County Commissioner, District 8. And let's start off with a really simple question. What areas of Miami-Dade County is District 8 and what do you cover?
Thank you so much, Hal, for all the good news that you bring to the community and for what you do for the community. You're a real civic leader. I appreciate very much.
And back at you.
Okay, thank you. It takes a village. So District 8, one of 13 Miami-Dade County Commission districts, starts north at Palmetto Bay, goes Cutler Bay, Naranja, Princeton, most of Homestead. To the west, it's Redland and parts of the Falls and parts of Kendall. So it's a very geographically large and diverse district.
Well, we appreciate you, and as many of the viewers that are watching this know, Danielle, you live specifically in Palmetto Bay, correct?
I do.
So what I want to do is understand a little bit beyond what the news is giving us. And, you know, I know that you're part of a group of people in politics and serving the people through government that are reviewing these contagion numbers every single day. I want to have a sense of how often you meet to discuss what the numbers are, and then how do you set policy or adjust things based on what you're seeing? What's going on kind of behind the curtain, so to speak?
Right. Such a good question. And unfortunately, the County Commission has not met for about 2 months, and we're finally going to be meeting next Tuesday. So business as usual was suspended as this coronavirus came and expanded. So it's been really a tough time. The mayor has been exercising executive powers, emergency powers. He declared a state of emergency. And in the last 10 days or so, we've been participating as county commissioners in a listening mode only to his daily briefings with the senior staff. We've had the opportunity to later get further detail or raise our suggestions to members of the senior team. But essentially, the mayor has been in charge without guidance from the county commission, officially speaking. So we have been on these calls, and it has been very sobering as the virus has progressed. We are getting daily briefings, and we're also monitoring the news media. The Department of Health puts out twice a day data. We have a situational report that comes out from our Office of Emergency Management at the county. And we have these calls, and of course the news media is constantly covering every aspect of the coronavirus story.
Got it. So there are numbers that we see on TV, online, through the radio. Why do these numbers matter? I mean, they tell us how many people in Palmetto Bay and Cutler Bay and Kendall have tested positive. Do those numbers mean anything? What do they translate to in real world concern and action?
Right. Well, yeah, the numbers do matter, but I think, you know, micro communities are less important than really the region. Okay, so at this point, we are still traveling across the South Florida region. So the risk of contagion is certainly there, and Florida statewide. That's why the Keys closed off, and that's why Florida is interviewing people coming in on the roadways. So there is an attempt to try to isolate and try to localize what the threat, what the risk is. But, you know, it's not like because there's no cases in Cutler Bay, but there are in Palmetto Bay, that you're any less at risk in one or the other city, because we know that this virus has certain qualities that make it particularly scary. First of all, it can travel great distances. It's a very resilient virus. It survives for long times on surfaces, and people are walking around having been exposed and possibly having contracted it without having any symptoms. So a lot of the symptoms may be very minor, and they might be confused with a common cold. So it's really, really hard to know who's contagious and who is not. And that is why we must really behave as though anybody is potentially carrying this virus and puts us at risk. And that's why all of these precautions have gone into place. The physical distancing, the use of gloves, the cleaning of the surfaces, the constant washing of our hands, and now more so the masks, because the thing about masks are that they prevent a person who's infected from spreading the virus, and they also provide some protection. Not foolproof. I mean, it's not the same as the medical grade masks, but it does provide some protection. So those are all the precautions that we need to be taking everywhere. And when we're out and about and congregating, it's more likely that we're exposed. And that's why we're at safer at home, stay at home, because it's just too much of a risk to be out and about.
You gave us something this morning. I was part of a Palmetto Bay Business Association meeting, and you gave us something else that I hadn't heard before. What you're hearing on television is if you suspect that you may have coronavirus, you are to call your doctor first, not go into the emergency room, et cetera. But you had mentioned the use of 311. Can you speak about that just briefly?
Yes, so 311 is our county emergency line. It's generally during times without crisis. It's the line that you call to get your garbage picked up or bulky waste trash pickup, that sort of a thing. But under these circumstances, it has become a lifeline, especially for seniors who are calling for meals. You know, we had thousands of seniors attending senior centers, getting a daily meal. Well, guess what? We had to close that down. Now, how are those seniors who are dependent upon those meals going to survive without them? So we started home delivery. And then that has opened up to other seniors who might not have been part of those programs. They can call too and get into the meal program. So we're delivering thousands and thousands of meals, and the door is open for more who need it. We're also currently providing for children. You know, not every child is in school getting lunch through the school feeding program. If you have a child that is in need of food, you can also register. And the county is looking at broadening that. Right now, that's where we are, but the county is looking at that. The other big function that 311 is playing right now is to schedule appointments for testing. So if you fit the criteria for testing, there's the Hard Rock Stadium site, there's the Marlins Stadium site, and shortly, within a couple of days, there will be a South Dade Government Center site. And all of those appointments are handled through 311.
So you brought up a very interesting point in my next question. So you go through your doctor or through 311, they schedule an appointment, and we've seen pictures of these testing sites, but we really don't know how they operate and how well they're functioning. And you had some insight on that as well. So please share with us.
Yeah, well, initially there was a big crush, and of course you have to have an appointment. So there should not be really lines for those test sites. They've prioritized frontline first responders, healthcare workers, seniors, people who have symptoms. Those were the top priority. Now the state has issued guidelines that any adult should be eligible, and particularly at Marlins Stadium, any age. But again, you have to have certain criteria to you can't just be anxious to get the tests. And as you mentioned, you know, your private physician might be able to prescribe a lab test, and you might be able to go to a private lab that wouldn't necessarily be free. And, you know, unfortunately, there's a backlog even in completing those laboratory tests. And so it's taking people a week or more to get the results, which is extremely frustrating and anxiety producing. So at this time, the county 311 site is taking those appointments. I think there's not a huge backlog, and really encourage anyone who feels that they've been exposed, has symptoms, is at risk, to please reach out to get that done. Unfortunately, it's a drive-through test. You know, you stay in your car. The city of Miami, and now I learned today, Key Biscayne, both are providing home testing for people who cannot get out. But we haven't done that in Miami-Dade County yet.
So you think you may have it, you go get tested, and eventually some portion of our population is going to end up at the hospital. And we spoke to Baptist Hospital earlier, and they're reporting that so far their capacity, they're faring well. There's nothing that's in crisis right now. What are some of the governmental concerns about how our hospitals here, particularly in South Florida, are going to be able to handle things in the near future?
So statewide, there is a daily call, and all hospitals report on available beds, available ICUs, available ventilators. So there's an effort to keep track at the state. At the current time, we're in good shape and projections are decent. But, you have to look at the curve. You listen to Dr. Fauci, and he tells us, even with the measures we're taking, we could be looking at 100 to 250,000 deaths in this country. So there is a curve for each community, and the curve depends upon how much we're following the social distancing protections. And if we don't follow them, and we were late in following them here in Miami-Dade County and throughout the state, and the governor just yesterday declared statewide safer at home. So we are late. So that means that the virus has been spreading, community spread, undeterred by these kinds of things that we're talking about. So we have to watch what's the curve. The predictions for Miami-Dade are by the end of April or beginning of May that we will hit hopefully the peak of the curve. Do we have the adequate ICU rooms? Do we have the adequate ventilators? Some concerns are being expressed. Our statewide emergency management director, Jared Moskowitz, today expressed that he had concerns. I believe tomorrow, Carlos Magoya will be on TV talking as well. And, we have the president deploying private business to produce more ventilators. We have the Army Corps setting up field hospitals. So, we're responding to the crisis, and we hope that we will have what we need in time for the major, what is the epicenter of the crisis? The
apex, yeah.
That's it.
Hey, listen, we're all at a loss for words recently. But again, thank you so much for sharing yours. I have a couple of other quick questions. Hopefully we can get through them. And I know you have pressing business to go out to right now. Our children are back at school, but this time they're doing it virtually. And, I've been out, I've got kids that are in school. I have friends who have kids who are in school. And this may not be directly asked of you, but maybe you know something. What I found interesting is most of the students are saying that even though they are going online, the teachers don't necessarily know how to use the live online part of the classroom for virtual learning. And what they're finding is, hey, here's your homework. See you tomorrow. Any sense of how our school board is handling this? Because as parents, we have to obviously make sure our kids are occupied and safe and learning, right? So tell us quickly what you know about that. Yeah.
Well, not my area of expertise, right, because we don't have any role really in the curriculum side of schooling. But I know that I've heard very good stories of teachers that are very engaged with the Zoom, and they're calling on children. And so I'm sure it varies with the level of familiarity of the teachers with the tools as well. But, this is a great opportunity if parents can do it, because parents have things that they need to do. Many of us are working from home, so we're not really able to be full-time teachers. But this is a great opportunity for parents to play a larger role. And I've heard it said now parents really, really appreciate teachers all the more so because they realize what a challenge it is. And there are a lot of resources out there. There's a lot of virtual learning modules. There's tours of museums. There's poetry and theater that can be watched online. I mean, there's endless numbers of things. Of course, you have to do the assignments, but as well, there's a lot going on. And for the smaller children, I've been doing story time Monday through Friday.
I've seen some of that.
On Facebook Live, which I have to say is the highlight of my day. So that's 11 o'clock, and please feel free, encourage people to sign up on my Facebook page and watch.
We are all learning what a new normal is and how to thrive, or at least get along with ourselves and people in our family during these interesting times. I do have one of these curveball questions for you because it happens to be something that you and I have been looking at for many years. Now that we have really quiet streets, is Miami-Dade County looking at ways to take advantage of that quiet? For example, are there roadway projects that should be taken care of now? Light timings. One of the things that you really championed was getting rid of the express lanes on the 826. And I know that was announced, it's got to be about a month ago. You'll tell me if I'm correct. Why are they still there? When will they go away? Talk about roadways and other opportunities the government has here.
Right. Well, I think it's a great question. Is this a good time to do construction that obviously is not going to inconvenience people as much as it would during the rush hour period? And I will bring that question to the Department of Transportation and Public Works. But at the same time, we can't do traffic studies because we don't have traffic. It's not a fair assessment. And we're exposing our workers to risks as well, although construction is still considered an essential business. So I'm not necessarily in agreement with that. I'm very concerned about the exposure. It's very hard to keep the kind of distancing that we need on a construction site. But in any event, mostly what I've seen are road projects being canceled or delayed, not canceled, delayed. But I am going to bring the point forward. As far as the tolls, I know the state agreed to stop the tolling on 826. And I can't tell you what the progress is on that. I'm guessing that you could take those lanes. I hope your people are still not being charged, but you could correct me if I'm wrong. The 836 does have the dedicated bus lane, which was something we fought hard for. And after that bus was launched with great fanfare, because it really does save time, unfortunately, a lot of the transit has been cut back because it's not being utilized. And also we're trying to protect people from being in situations where they can't distance. But, people still need to ride transit. People are still working. And hopefully that bus will come back soon.
Daniella, thank you so much for your time. You're always out there and, with the people. And I really appreciate the opportunity to talk to you at a more human level rather than the news sound bites. Is there any way that you can extend? How do people get in touch with your office if they want to ask specific questions that weren't addressed here?
Yes. Yeah, we're working hard. In fact, my staff is working harder than ever because there's so much to try to keep track of it. And then we try to communicate with the public everything that we learn, as well as take regular constituent questions and concerns. They still, life goes on. So we're at 305-378-6677. Again, 305-378-6677. People can write us at District 8 at miamidade.gov, and our team is ready and able to assist. Thank you so much, Hal.
Yeah, thank you so much, Daniella Levine Cava, District 8 County Commissioner, and we really appreciate your time.
And sign up for our newsletter and follow us on social media. There's a lot of good information.
There's your government plug. Have a great day.
Thank you. Good night.